Hello, I'm Dr. Charles Gardner, Medical Officer of Health. This is a worrisome change. If we look at for the week that began on the 14th of February, it was a total of 275, whereas the week before that it was 210, the week before that it was 285, and then before that 307. Going back to the beginning of January, we had a downward trend from the beginning of January, and now we've had this 30% increase in our case count. That is worrisome to me. And later on, I will be speaking to the increasing case count of variants of concern, including the B117 UK variant, that too has been going up, including unlinked cases that aren't part of outbreaks. And that we've had geographic spread as well, with variants of concern in outbreaks that have also included Muskoka as well, Simcoe. So those two facts, the increased case count overall and the increase of variants of concern, are of concern to me with regards to the level, the zone that we're in right now. I'll reflect on this later. We've had 8 people pass away from COVID-19 over the last week, and I would like to express my condolences to the family members of those people for your loss. In total, we've had I do hear somebody speaking or whispering on the line. If you could please check your line and mute it, that would be helpful. Thank you. So, as I said, I would like to express my condolences for the people who've lost family members from COVID-19. Since the beginning of February, we've had 29 people in total pass away from COVID-19 in Simcoe, Muskoka, which brings our total count of loss of deaths to 187 cases since the beginning of the pandemic. 84% of them have been part of institutional outbreaks. So the people who've passed away in the past week are as follows: a man between the ages of 65 and 79, a woman who is over 80 years of age, a man who is over 80 years of age, a man between 75 and 79, a woman over 80 years of age, a man between 65 and 79, a man over 80 years of age, and a man between the age of 65 and 79. Of the 76 cases that we've had reported so far at the beginning of this week, 69 of them have been sporadic cases. 6 of them have been part of institutional outbreaks, and 1 has been part of a work-related outbreak. Their ages range from under 10 to into their 70s. 46 of them are men and 29 women. 73 are in Simcoe County, and none are in the District of Muskoka, with 3 unknown at this time. 4 are community acquired, and by that I mean that we don't know how they acquired their infection. 15 are close contacts of a case. 1 is travel related. 6 are part of institutional outbreaks. 1 is part of a workplace outbreak, and 49 are under investigation. 74 are under self-isolation, the other 2 in a facility or hospital. We have a total of 564 active cases right now, which is down from 666 a week ago. We've had 5,504 recovered, which is up from 5,106 a week ago. 46 of our cases of those who live here are in hospital, which is up from, I beg your pardon, 24 of the cases that we have are in hospital right now, which is up from 23 a week ago. Their ages range from their 40s to their 80s. 23 are from Simcoe County, and 1 is from the District of Muskoka. 4 of them are in the intensive care unit, and they're in a range of hospitals: RVH, South Lake, Princess Margaret. One unknown at this time to us. The great majority of the new cases that have occurred, or cumulative cases that we've had to date, have resided in Barrie, Bradford, West Gwillimbury, New Tecumseth, and Innisfil, so South Simcoe. This week, the incidence of cases in Barrie is 108 per 100,000 population per week for the week. This is doubled over it was a week ago, so certainly this is part of the pattern that I'm concerned about. This is the first increase that we've seen in Barrie residents over the last 3 weeks. And it's mainly due to non-outbreak related transmission of people in households, household clusters of cases, though we have seen some of these associated with work-related cases elsewhere. And I would also note that we've had some incidents of transmission between Simcoe and Muskoka as well, individuals living in one location and traveling to the other for work. So no other municipality at this time has had a weekly incidence above 100 per 100,000 population. Currently we have 16 ongoing outbreaks, which is down from 22 a week ago. 4 are in long-term care, 1 in a retirement home, 1 hospital outbreak, 7 workplaces, 1 community setting, and 2 educational settings. So the 6 institutional outbreaks are down from a week ago. They were 12, so 2 new outbreaks: Leacock Care in Aurelia and Sarah Vista Long-Term Care Facility in Springwater. And we have 7 outbreaks that were declared over the past week: Roberta Place, Simcoe Manor, Georgian Manor, Amica Lake Retirement Home, Georgian Traditions, and one other that I can't actually make out, I'm afraid. I'll have to follow up with everybody with the last one. We have no congregate setting outbreaks, so down from 1. So there was 1 declared over in the past week, a group home in Simcoe County. We have 7 workplaces in outbreak, up from 6 a week ago. 5 new ones, so 2 manufacturing facilities in Simcoe County, a professional, scientific, and technical facility in Simcoe County, an agricultural location in Muskoka, and a food and beverage location in Muskoka. 4 are declared over: retail, trade location in Simcoe County, 2 financial and insurance facilities in Simcoe County, and 1 food and beverage location in Simcoe County. We have 1 community setting outbreak, which is unchanged from a week ago, and we have 2 educational settings, which is up from 1 a week ago. So 2 new locations: a private school in Barrie and Innisfil Central Public School in Innisfil. We aren't at this time naming the private school. This is actually the first time we've had a private school in outbreak, and our practice there is because the province doesn't actually name private schools on their website. This is something that I'm going to reconsider. We have 1 declared outbreak declared over in a child care facility in Simcoe County. So with regards to the variants of concern of COVID-19, at present we've had 171 cases to date of the B117 UK variant, up from 153, and 216 individuals screening positive for the N501Y mutation, the mutation that signifies it's probably a variant of concern, awaiting confirmation as to which variant it would be. And this is up from 131 a week ago. And we've also received a large number of negative test results on screening as well. So if we look at our weekly count of variants of concern, the totals they total as follows. So the week of January 31st to February the 6th, we had 64. The week of February the 7th to February the 13th, we had 132. And the week of February the 14th to the 20th, we had 151. And they break down between being the screen positive VOCs versus the B117 UK variant. So overall, we've had 6 outbreaks from the UK variant, the B117 variant, and 9 institutional outbreaks from individuals that had screened positive for a variant of concern awaiting confirmation as to which type it was. And 8 of these outbreaks are ongoing. 3 of them, the variant, the UK variant, and 5 of the screening variant of concern awaiting confirmation as to which type. There have been 3 institutional outbreaks that have the V117 of concern, another 7 institutional outbreaks at screening. Yeah, actually, this just having a look at the details on this. 3 institutional outbreaks that have screened positive for the B117, and 5 that have screened positive for the variant of concern, as I'd indicated before. So Bradford Valley continues as an outbreak. So it's there are 11 cases of the B117 variant, which is up from 9, and 7 which have screened positive for the variant of concern awaiting confirmation as to which type, up from 6. We have 12 cases of the UK variant, B117, at Waypoint, which is up from 11 a week ago, and 7 that have screened positive for a variant of concern awaiting confirmation as to which type, up from 6 a week ago. And we're still getting tested results on Roberta Place, even though that outbreak has been declared over. So we've had 87 positive test results in that outbreak of the B117 variant, the UK variant, which is unchanged from a week ago. We have 22 test results that have screened positive for a variant of concern awaiting confirmation as to which type, which is up from 20 a week ago. IOOF remains with 1 screened positive individual awaiting confirmation as to which type. Barry Manor Retirement Home has 4 cases that have screened positive awaiting confirmation as to which type, which is up from 1 a week ago. Simcoe Manor has 1 screen positive test result awaiting confirmation as to which type it is, which is unchanged from a week ago. Georgian Traditions has 1 screen positive test result awaiting confirmation as to which type, which is unchanged from a week ago. We also have non-institutional outbreaks of variants of concern. So we have an apartment complex in Simcoe County, which I've spoken to before, and so far that we have 1 individual testing positive for the UK variant B117, which is unchanged, and 15 who screened positive, up from 14 for a variant of concern, awaiting confirmation as to which type. We have a retail location in Simcoe County with 2 B117 positive individuals. We have emergency services location, testing in Simcoe County, testing positive for one individual with the B117 UK variant, and another individual who's got a positive screen for a variant of concern who lives out of jurisdiction, and therefore they wouldn't be on our line list. We have a manufacturing facility in Simcoe County that has 7 individuals screening positive for a variant of concern, awaiting confirmation as to which type, which is up from 3 a week ago. A finance and insurance location in Simcoe County with 1 positive screen, unchanged from a week ago. A new location, agricultural location in Muskoka, with 2 individuals screening positive for a variant of concern, awaiting confirmation as to which type. And a new manufacturing location in Simcoe County with 2 individuals screening positive, awaiting confirmation as to which type of variant. And a new food and beverage services facility in Muskoka with 5 individuals testing positive for a variant of concern, awaiting confirmation as to which type. We also have a number of cases that are unlinked in the community, unlinked to any outbreaks. So we now have 6 B117 UK variants of that nature, which is up from 2 a week ago. And we have 111 cases of individuals screening positive for a variant of concern, awaiting confirmation as to which type, which is up from 54 a week ago. And 2 of those are in Muskoka, which is up from 1 a week ago. In terms of vaccination, we continue with our immunization, and at this point in time, we've done over 35,000 immunizations, up over 7,000 in the last week. And 92% of the residents in our long-term care facilities are completely immunized, both doses. And we have 87% of residents in retirement homes in Simcoe, Muskoka who have received their first dose of vaccine. And we actually had reached all of the homes on Saturday last week. So we note that to be a very important milestone. We need to be protecting the residents of these facilities. They're the most vulnerable people in our communities. So I will be speaking later to our intentions with regards to immunization to come, but we've made good progress in protecting those most vulnerable in these homes. In terms of our dashboard, which is different from the provincial framework, and we actually will have information now on our website about how we score on the indicators of the provincial framework. I'll be getting to that later, but to talk about our own dashboard, we remain in red status, with red with regards to viral spread and containment, considering that we're actually moving up further. That would be all the more concerning, and also the impact, although we don't specify in this framework the UK variant, that is certainly on my mind. Laboratory testing, we remain in yellow status due to a limited turnaround time for testing. So 52.8% of our tests come back within 1 day. We have a goal of 60%. And we also have a percent positivity, which is similar to what it was last week, actually slightly higher at 2% as opposed to 1.9. So not heading in the right direction. We have health system capacity at yellow, and this is due to the use of acute care and ICU beds remaining at that status. And the public health system capacity remains at red because our limited capacity to be able to get to all cases within 24 hours is below our target of 90%, presently at 61%, which is down from 89% a week ago. We're challenged on this front because of our increasing case count, but also because of the complexity of the contacts involved with the cases and the fact that we're doing much more intensive follow up with the cases and the contacts in response to the UK variant, the variants of concern. So our trajectory overall is not headed in the right direction. Our weekly incidence is up from what it was a week ago. It's 46.3 cases per 100,000 population, up from 35.3. So by the province's framework, on this indicator, above 40 would put us in the red. We are actually in the red status provincially. That's because I wanted to be more precautionary, and I had advised the Chief Medical Officer of Health to that end. Definitely are meeting this criterion now for being in the red category. And I note that the province is also down to 50 cases per 100,000 population. And last week it was 53.7, so they are down. And I would also note that this is the closest we've come since the summer to having a rate, an incidence that is the same as the provinces. Typically we've been half the rate of the provinces, so I think this speaks to us heading in a different direction from what's happening in the province overall. Once again, an indicator of concern for me. Our reproduction number is 1.4, which is an increase from the previous week at 1.1. So anything above 1 is of concern. It means that the pandemic is growing in our community, not shrinking. And 1.4 is one of the highest rates we've ever had. In Ontario, the rate is 1.0, and it had been 0.9, so the province is slightly up, but not as high as we are. And our doubling time has decreased to less than 4 months. So we're doubling now. If we continue at this rate, we'll double in our numbers after 115 days, which is down from what it had been a week ago at 136 days. So this is something that we want lengthening, not shrinking, and we're headed in the wrong direction once again. What I would say is it's we have had the situation of very unfortunately having a very large number of UK variant cases. The other variant of concern, screen positive cases, will probably turn out to be the UK variant, though we await confirmation of that. This is a more transmissible version of COVID-19, and the experience in some other countries, the United Kingdom and Ireland and Denmark, has been that when they've seen a rise in this variant within their communities, that they then had another wave of COVID-19 that they had to manage with a shutdown, a lockdown. So I'm watching this very closely and have communicated to the province my concern about where we're headed, and positioned that we need to be prepared to go into a shutdown again in the near future if in fact we continue to see this. So this is something that I think people need to be aware of. With regards to our outbreaks, and I'm going to work through the outbreaks as I usually do in order of the date in which they were declared. Our institutional outbreaks: Grove Park Long-Term Care Facility outbreak declared on January the 4th. There are 13 positive staff cases and 2 positive resident cases that have remained unchanged over the past week. And as I'd indicated before, 97% of the residents in this facility are immunized. I must say that I've noted with regards to the UK variant that certainly we've had severe outbreaks, and most notably Roberta Place. But our more recent outbreaks in facilities with this variant have remained in very small numbers, and they have very high resident immunization rates. I believe that immunization has been absolutely critical in helping to protect them from becoming more severe. I mean, it's not finished until it's finished, but I do note that, and I do note, therefore, the importance of immunization in these facilities. Bradford Valley Care Community, outbreak declared January the 14th. They've now have a total of 5 deaths, up from 2 a week ago. They have 10 positive staff cases, up from 7 a week ago, and 16 positive resident cases, up from 15 a week ago. Waypoint Waypoint Center for Mental Health, outbreak declared on January the 22nd. We have a total of 7 deaths among the residents, which is unchanged, and 15 staff cases, which is up from 1 a week ago, and 17 patient cases, which is up from 16 a week ago. Berry Manor Retirement Home, outbreak declared February the 10th. A total of 3 staff cases, up from 1 a week ago, and 3 resident cases, up from 2 a week ago. 92% of the residents immunized. Sarah Vista Long-Term Care Facility, a total of 1 staff case, outbreak declared on January the 12th. Leacock Care Long-Term Care Facility, declared on February the 22nd. 1 staff case. In terms of our educational facilities, in outbreak, we have a private school in outbreak with 2 cases, and for schools, I'm not making a distinction between the students and the teachers, because the numbers are often small and we need to protect the privacy of individuals. Innisfil Central Public School declared as an outbreak on February the 16th, 3 cases. Our congregate settings, otherwise we have no outbreaks. Community settings, we have an apartment complex in Simcoe County. It's one of the variants of concern situations. We have a total of 26 tenants who are cases, up from 25 a week ago. And very sad to report that there was a death among this location. We have 7 outbreaks in work environments. So 1 food processing facility in Simcoe County declared as an outbreak on January the 17th. 22 staff cases, up from 21 a week ago. A manufacturing facility in Simcoe County declared as an outbreak February the 10th, with 10 staff cases, up from 6 a week ago. We have a manufacturing location in Simcoe County is declared as an outbreak on February the 17th, with 11 staff cases, and that would be unchanged, actually, considering the timing. There hasn't been a week since I last reported on this. It started on the 17th. We have a food premise in District of Muskoka declared as an outbreak on February the 17th, with 5 staff cases. We have a professional, scientific, and technical services location in Simcoe County declared as an outbreak on February the 19th, with 2 staff cases. An agricultural facility in Muskoka declared as an outbreak with 5 staff cases. And we have a manufacturing facility in Simcoe County declared as an outbreak on February the 19th, with three staff cases. So that's all of the outbreaks. Turning to my key messages. Next week is a really important week with regards to immunization, in that on Monday, the 1st of March, we will be opening up locations throughout Simcoe, Muskoka for immunization, community vaccination clinics. We have 6 subregions, and we have at least 1 in each subregion. And I'm going to be providing a press release later in the week by Thursday to give specific information about the locations. Because of course people would want to know that information, but and it would be important for them to know that information, because what will also be in that press release is information about who would be eligible specifically to book themselves for immunization, and how they could do so, the website that they could use in order to access this, or the phone number that they could access if necessary. So that information will be coming shortly. We just need to finalize some details on all of that. And to get fairly specific, we will have 3 locations between Barrie and Innisfil, 2 in the District of Muskoka, 2 in North Simcoe, 2 in Southern Georgian Bay, so 1 in Collingwood and 1 in Wasaga Beach, 2, I beg your pardon, 3 in South Simcoe, and 1 in the Aurelia area. And we do anticipate change over time too, the potential for pop-up and mobile clinics, the ability for us to continue to go out to other congregate settings and provide immunization as well. Working this week with our 4 First Nations communities to provide immunization on those locations. So we're going to take a very broad approach to make COVID-19 vaccination available to our community. It's important to know that we are working through priority groups designated by the province and based on risk of transmission to themselves, risk of severity of outcome, risk that they could not only become a case but transmit to others who are vulnerable. So very much the earliest stages has been on long-term care facilities and alternate level care recipients in hospitals, and on staff who provide care in those settings and in hospitals. And over this week, we've moved into providing at our fixed location in Barrie immunization for other high priority healthcare workers, so paramedic service providers and fire, and those who work in assessment centers and home care. But starting next week, we're going to be moving into other priority groups as well. So they will include people above 85 years of age and older. Now, there was an announcement made provincially last week that there would be the provision of vaccination by mid-March to those 80 and above. We wish to commence indeed with those 80 and above, but that's a very large population, so focusing at this point on those 85 and above to begin with at the beginning of March, and then moving on from there. Like I said, we'll be announcing how people can book for themselves, a website and a phone number. We're also putting out information to family physicians so that they can help with outreach to their patients who fall into that category, and make them aware of how they can book. We're also going to be commencing vaccination for the Indigenous adult population in our communities, those 55 years of age and older. The recipients of adult chronic home care, and what the province deems to be very high priority healthcare workers. So continuing with the healthcare workers that I've identified already, but also looking at others who provide a direct care to COVID-19 cases in the community or in facilities. And we will get quite specific in the communication to come so that those individuals would recognize themselves, and we'd also be putting that information out through our health facts to healthcare providers so that they're aware of that. It will take us time to be able to move through all of those people. It will probably take us all of March and all of April to be able to move through all of those people, and so we wouldn't be able to book them all at once, and we would be taking a waiting list for people that fall into that category, and we will be screening for people who don't belong to those categories at this time. We will be asking people to test that they fall into these categories, and be asking that they provide some kind of professional documentation on this as well, because everybody wishes to get this vaccine, and in due course it's very important that everybody get this vaccine, but it's most important that we provide it to those who need it the most first before we can move on to others. Okay. There's been, with regards to children attending school and childcare, a change in the daily screen that parents should be applying to these children to look for symptoms of COVID-19 and to withhold them from going to school or childcare. It's become more rigorous, with a single symptom only required in order for that to be the case. And we'd be asking that in such households, others not go to school until that individual has been assessed and determined whether or not they have COVID-19. So that's important for people to be aware of. And we have information to that end on this topic on our website, and would invite people to have a look at that. But very important in order to keep our schools safe for everybody involved. Important that anybody that's a case would be off while they're symptomatic. Anybody that's a contact of a case would be off. A case that they have to be off for at least 10 days from the date of onset of symptoms. Those who are contacts, up to 14 days from contact with an individual who's a case. And if the symptomatic individual is not getting tested, then we err on the side of caution by having the contacts off for the 14 days, assuming that the individual with symptoms is actually a case if they're not getting tested. We've got now on our website an infographic on a cluster of cases of COVID-19 that we had late last year, demonstrating just what an impact it can have. So we've had infographics like this before on our website with other clusters. So this one shows that in less than 3 weeks, a community of moderate size can have 3 outbreaks, and outbreaks in 2 schools and a workplace, a case that required hospitalization, 25 people identified at risk of contact in isolation, and 14 households with at least 1 confirmed case. So this is meant to demonstrate the nature of how this spreads in the community from locale to locale. I've talked before about households in which you have large numbers of people that can be affected in a rapid time, and that if they have places where they work or schools that they attend to, you can have the spread elsewhere. This is all the more worrisome with COVID-19, and we have started to see this pattern with COVID-19 as COVID-19, the UK variant as well, because we've seen situations with households that are affected and then work environments that are affected, or links from the large facility outbreaks that we've had. So the point that we're making with this infographic is that people need to really understand and take to heart the importance of reducing or avoiding spread by isolating yourself if you have symptoms and seeking testing, or isolating yourself if you've been a contact of a case, or for that matter, somebody with symptoms. You should be isolated until we get clarity about what you're dealing with. To me, I always go back to the importance of stay at home. It's a simple message. And even though it's not a requirement by regulation at this time, and here in Simcoe, Muskoka, I urge people to behave as though it is a requirement. And so you should stay at home unless you have an essential reason for leaving your home. So seeking medical attention, going to your work, school, buying food or necessities and physical activity, but otherwise staying at home, not having people over from out of your household. The only exception being somebody who lives alone would adopt one other household to be close to like that. And not going over to other people's households, not visiting their homes. We need to behave as though there actually still is a stay-at-home order, especially now that we're moving in the wrong direction again with regards to cases. So on our website right now, we've got a framework report that shows us how we fare on the individual indicators that's on the provincial framework, so that people can see that we align right now with red according to that framework, though in my mind with us moving in the wrong direction, we need to seriously consider whether or not we should be moving into, in fact, a shutdown. So anyway, that is there as a resource. And one other thing I would say before I get into the meaty questions is that the Board of Health at their meeting last Wednesday endorsed a position of advocacy to the province, asking for the province to support paid sick leave. And this is meant to reduce people going to work with symptoms, or for that matter, reducing them going to work if they are under quarantine because they've been in contact of a case. We know that a certain amount of transmission happens in the work environment. We know that for sure. We've seen that with our own stats. And we know that some of that is related to people going to work with symptoms or having been in contact with a case. So one of the ways of reducing this is with paid sick leave, an additional 14 days of paid sick leave for an public health emergency basis. So media questions that we've received are as follows. What is the role of SMDHU with regard to Roberta Place and other long-term care homes right now? Do you have any say on protocols inside the homes, or are you available for advice? So we are most definitely available for advice. And in any facility in which they've been an outbreak, we can issue orders if necessary, and certainly provide them with direction about what is needed in response to the situation. And we still have in place our orders for Roberta Place and are continuing to monitor and work closely with that facility as they work through a plan of action to ensure the safety of that facility. So that's happening in a very cooperative, team-like manner, and we certainly make requirements of other homes as well as needed related to their outbreaks. What was learned from Roberta Place? If the warnings were there from long before January the 8th and the virus still did what it did, what has been and can be changed now? So I would say that it's important for all of our homes to do all that they can to be prepared for an outbreak and to reduce the likelihood of an outbreak, to address findings that have come about through assessments. Our homes have been through assessments that have been facilitated with the Regional Infection Control Hub, and often assessments done by the health unit as well. And it is appropriate for them to work through those findings and address them to the very best of their ability. And one of the key things to protect homes is now in place for the homes, and that's immunization of the residents and the staff as well. So I would recommend that they do all that they can to encourage their staff to be immunized, and to ensure that any new residents who come into their facilities are given the opportunity to be immunized as well, and to reach out to us to help with that as much as possible. That is something that was not available and possible for Roberta Place, just because of the timing and the date in which we were able to start to give immunization to the facilities. But it's certainly now in place for the residents and to a large degree for the staff. And we're still available with our clinics, the ones that are opening up, and the one in Barrie that has continued to receive staff that would want to be immunized, as well as the essential caregivers of those facilities. There's been trepidation on reopening the provinces early. When might we see possible negative effects, if any, from the lifting of restrictions? So what I would say is we're seeing an upturn now in our cases. And I actually think that it's a week too soon to indicate that it's due to us moving out of the shutdown and into red, because there's a lag period of over a week, typically 2 weeks, before you'll see that impact. It takes that long for transmission to occur and then cases to materialize and be tested and be reported to us. So we've seen this in a week rather than 2 weeks, and I think that speaks to the potential impact of the variants of concern of the B117 UK variant being more transmissible, and the fact that we've had a very large number of these cases because of our outbreaks that have happened here. So we're already seeing a negative effect even before the effect of coming out of the shutdown has materialized, and I am very concerned. Is there a part of you that sees we still may be good and may avoid a third wave? I'm positioning now that what we're seeing is probably the beginning of another wave, and that we need to get on top of it and limit it. And individuals can do that by doing their part with regards to my advice that they stay at home. Follow the stay-at-home direction, even if it isn't a legislated requirement at this time. Is the health unit leading the asymptomatic testing at schools? Who should parents be looking to for more information? So the asymptomatic testing at schools is a responsibility given to the school boards by the Ministry of Education, and as health units we are there to advise and support them in that task. But questions about the status of that would be most appropriate to go to the school board. So we're happy to take questions ourselves about this. We do have a Health Connection line and email line, so we're happy to take it, but the primary responsibility actually rests with the school boards. And my understanding is that they're presently working through exactly how they will approach that responsibility from the province. I know it's relatively early in the year, but have any determinations been made on the odds of overnight summer camps in Simcoe, Muskoka being able to operate this season? So last year they were not able to operate. We were being very precautionary about that. And this is a particularly important question for Simcoe, Muskoka, because we have more of these summer camps than any other health unit in the province, perhaps a third of all of the province's camps. And so it's of importance to us, and we have a major responsibility as a health unit in their operation and how they would operate safely, and also certainly in response to outbreaks from any of these camps. But the decision will ultimately be made by the province. It's before the province now. It's a kind of question that comes to the public health measures table, of which I'm a member. What happens at the table is confidential, so I cannot speak to it. I would say that it, the approach to answering that question would have to be a consideration of the tremendous benefit of camps for children and their development and well-being versus the risk of COVID-19. And we found that transmission is lower in children, so that would weigh in favor of the potential for a camp stay to open. But we now have the new variants of concern here, which would weigh counter to the potential for camps to open. We have immunization happening, and the hope that we would get to a large number of the population by the time we get to the summer, but we probably won't be finished immunization before you're into the summer. We probably have to carry through the summer to be able to do that. So in that regard, it would be coming a little late. And we also know that so far the vaccines are not for children. They're for adults based on manufacturer's specifications and the fact that the clinical trials have only been done on adults. There is some research coming about the potential to immunize children, but so far it's for adults. So immunization would help reduce transmission overall in the community, but children actually wouldn't have been directly immunized and wouldn't have that benefit of protection. So at this point, it's unclear. So at this point, I'd be happy to take questions.
Thank you, Dr. Gardner. We're going to start with Chris Simon from the Variance band.
Thank you very much. Dr. Gardner, in almost every daily report, you see that Barrie has significantly more cases than any other municipality in Simcoe, Muskoka. Can you explain why that's the case?
That's a good observation. I mean, in part, it's more southerly, but it's not the most southerly municipality. In the other more southerly municipalities, it's about people working to the south in the more heavily hit parts of the province. There are certainly people in Barrie that do that too, so that would contribute. But we've also found that there's been this dynamic of households, often households of unrelated people, who have some social interaction that can lead to transmission, that have jobs that can lead to transmission once it gets into the household. All the household members are affected, and then the cycle continues of transmission in other work environments or other facilities that they would work in. So I see that dynamic unfolding in Barrie.
Okay, and my other question is, we've had it posed to us about a number of asymptomatic people that catch the virus. Does the health unit keep statistics around who shows symptoms, level of severity, anything like that might help bring some clarity to how many people are seriously falling ill?
Mm-hmm. Well, certainly one way of looking at serious illness would be the percent that are hospitalized. So we've got clear data about how many are hospitalized on our website. And we do actually keep some figures about how many are asymptomatic. I could look into that figure for you and get it to you, but it's usually in the range of 15% or so of the cases that we've had.
Okay, wonderful. And if I could just ask one more question. You have mentioned several times that you see dramatic increases in the numbers. At what point does the health unit ask the province to maybe go back into some variation on a lockdown?
I am very seriously considering it right now. I think you are more effective if you act early than if you wait for it to become well entrenched.
Thank you.
You're welcome.
Thank you. We'll go on to Erica Engel from Collingwood Today.
Thanks. Further to that line, Dr. Gardner, there's that emergency break that you talked about after the shutdown. Is that what you mean by you're considering it?
And that's a term that's been used by the Chief Medical Officer of Health, been used by the province. And their concept was that a local medical officer of health could make that request and it would be applied to their health unit. So I think that's a reasonable application of the term in this situation.
Okay, and regarding immunization and you're starting the clinics on March 1st, does that mean that you no longer have the concern that you're going to be short vaccines? Like, is the supply flowing again, sort of similar to what it was in December?
Thank you for raising that question. I probably needed to be clear about that. We will only be able to operate those sites with the volume of vaccine that we get, and we don't anticipate that it's going to be large during the first week of March. It'll be a really limited run that we're going to have. So we're going to use it as an opportunity to fine-tune our operations as we start up those sites. So people will have, I would like them to be aware of that and to hold their expectations accordingly about how quickly we will be able to get to people.
Thank you.
You're welcome.
Thank you, Erica. I'll just remind everyone, please put your phone on mute unless it's your turn to ask a question. And we're going to go to Sean Gibson from Barrie today, please.
My questions were answered. Thank you so much.
You're welcome.
Thank you, Sean. We'll go on. Sorry. Matthew Riesler from Muskoka.
Yes, I thank you, Doctor, once again for doing this. You mentioned at an earlier briefing, and I know right now we're going through some shortages in terms of the vaccine, but you mentioned before that Simcoe, Muskoka was among the leaders in the province in terms of public health units of getting the vaccine, getting shots in people's arms. Is that still the case? Do you know where our health unit region stands amongst the other ones in Ontario in terms of vaccine distribution?
So that was based on a graph that we have access to that's put out on a regular basis. I don't think it's public facing, that showed levels of immunization to date by immunization site. So it wasn't actually broken down by health unit, it was broken down by clinic. And for a very long time, we were number 2, right behind Ottawa. And only when we started taking the Pfizer vaccine and diverting a good portion of it to give to the long-term care facilities in those facilities did we cease to be number 2. We, as an artifact of us taking a lot of the vaccine and no longer giving it at our site at the clinic in Barrie, but instead moving it to the long-term care facilities, we came down to perhaps 4th or 5th, and that's about where we've been sitting ever since.
Okay, thank you, Doctor.
You're welcome.
Okay, Brett Glover from Barrie 360.
Well, thanks very much. Doctor, we heard yesterday from the provincial government that Ontario's 34 public health units would be in charge of submitting plans to roll out broader vaccination. Sounds like their plan is well underway, but critics say that the onus is downloaded to local health units like the SMDHU. Other than vaccine distribution, can you tell me what contributions and what role Queen's Party is playing in all of this?
Thank you for the question. I actually spoke on this on behalf of the Association of Local Public Health Agencies in my role as Vice Chair for the Council of Ontario Medical Officers of Health yesterday to CTV. And what I indicated was it is in fact our role in local public health to provide immunizations in general and specifically in response to a broad outbreak like a pandemic. That we are the ones that need to do that. We do need local plans to do that well, particularly with something that's more complicated like this pandemic with more than one type of vaccine and with vaccines that require 2 dosages and with the limited supply of vaccine at the very beginning and priority groups to work through. So we went through something similar but less complicated with the H1N1 influenza pandemic of 2009. And so it's appropriate that we play this role, and really only we can play the role of having a plan in place where we know where the priority populations are in our communities, and we know where the opportunities lie to work with others to set up clinics with municipalities and primary care providers and EMS and community pharmacies. The province would not be able to do that from a distance. They need someone closer to the ground to be able to do that, and that is our role and has long been our role. The province is doing what it should and needs to, and that's to set the overall parameters for immunization. the priority groups, the amount of vaccine that we're receiving, the expectation that we would develop a plan and a playbook for us to follow to develop that plan. As something that locally medical officers of health helped to create that playbook on behalf of the province, but it is the province's document that we followed and continue to follow as we develop and update our plans locally. And I have to keep it as a living plan because the circumstances change over time, new vaccines come out, new opportunities arise, or unanticipated challenges arise as we go. So any plans that we have to be living and changing. As a health unit, we're committed to getting our plan up on our website so that the public will see it, and we should have it in place on our website by Friday of this week. I would also point out that the province is financing all of this as well. That's a critically important role.
No, fair point, sir. You've already addressed my follow-up question, so I'll thank you for your time.
You're welcome.
All right, on to Allison Brownlee from Muskoka region.
Thank you very much. A little trouble with the unmute button there. Thank you. Answered quite a few of my questions already. In terms of the clinics that are going to be launching in Muskoka, very excited to hear that we're going to have two. How will the health unit determine how many vaccines Muskoka will get of the limited total you'll have at least at the start?
So we have tallied the number of people throughout our district and on a municipal basis who are in the priority groups. And we will therefore allocate the amount of vaccine based on the percent, that tally as a percentage of what we have throughout all of Simcoe, Muskoka. And then we're also going to adjust that number based on the amount of disease that's been transmitting. So we've had a lot more disease in the south. That'll be a less influential figure. The major figure is just going to be the number of people that you have that fall into those categories.
Perfect. Thank you very much for that. And who will be your partners in facilitating these clinics in Muskoka?
The family health team, hospital, EMS, probably community pharmacists.
Okay. Thank you very much.
Yeah, you're welcome. Did I mention the municipalities? The municipalities are key.
Oh, perfect. Thank you.
Yeah.
James Bowler with Coachco.
Hi, sorry, having issues with mine as well. Dr. Gardner, first question for you, just wondering if there is any possibility of providing a little more clarification on the location of these variants of concern in Muskoka. Now, I understand when it comes to the outbreaks, that may be a privacy concern issue, but with the ones that aren't related to the outbreaks, the two that you mentioned, is there any possibility of clarifying exactly where in Muskoka these have been tested positive?
So we don't give more specific information about location or anything that might help identify the individuals. We have to protect privacy. The other thing I would say is I think the takeaway message for people is assume it's in your community, in your neighborhood. That's the safest assumption, and therefore abide by the stay-at-home recommendation.
Yeah, and just in terms of the vaccination plan, I know you kind of mentioned you answered a bit of the questions on that with Allison, but I was curious if you had any details on which specific groups you'd be focusing on to begin with. And do you know exactly how many vaccines we're going to be getting in this first round?
So the second question, we're getting about the same volume that we've gotten in the past couple of weeks. We've been asked not to give the exact volume by the province for security reasons. So therefore I won't be. I would say we anticipate volume of vaccines coming through March and into April that would allow us to get through all of this tier of priority individuals through those 2 months. And as for the priority groups themselves, we'll include fairly fine detail in our press release to come, but it really comes down to people. At this point, we're focusing on 85 and above. In the future, it'll get down to 80. And the Indigenous population, adult Indigenous population, at this point focusing on those that are 55 and above, those who live on the 4 First Nations communities, and healthcare workers who provide direct care to patients, some of whom may be or are, in fact, COVID-19 positive individuals. And those would be healthcare providers in institutions, but also in the community.
Fantastic. Thank you very much.
You're welcome.
And we'll go on to Mark Claremont from Muskoka.
Yeah, hi, Doctor. It's also on the next week's rollout there. So, is it possible that people could go from, just specifically from Muskoka to Barrie to get book an appointment with the new clinics opening up next week?
So that's a very good question. We asked, do we want to limit this in some way geographically? And we know that this is a mobile society. We also know that a lot of people go to Muskoka who are seasonal residents, and we need to plan for more of that as you get into the warmer weather. And in terms of the allocation too, we need to, of how much vaccine we would provide at those clinics, we need to take that into account, because if you don't immunize people that move around, then your community remains at risk. The people that come into your community, if they're not immunized and they can't get access to it, then transmission can still happen via those individuals. It's in our interest to immunize people, even if they're moving around, maybe even all the more so that they're moving around, because they could be transmitting it from a higher incidence location to a lower incidence location. So if somebody goes from Muskoka to Barrie to get their vaccine, they would receive it. Provided they are in the priority groups that we're addressing at this time.
Oh, yeah, absolutely. Right. So that's also, I'm just curious, trying to figure out what my question is that I wrote down there. So if people so you're saying that they're community acquired. I'm trying to figure out this. How do you compare community acquired versus the number of cases overall, or specifically the variant? My apologies there. So how do you determine that the community acquired versus just people getting it and things like that, right?
Okay. So in general with COVID-19, and this would apply to those with the variants of concern as well, community acquired means we don't know how they got it. And generally we've had less than 30% that have been community acquired. The others we've been able to link it in some way, linked with an exposure to somebody else who has it, or they're part of an outbreak in a facility.
Yeah, okay, that's fine. Yeah, thanks very much there.
You're welcome.
All right, have we missed anyone who's had a chance to ask Dr. Gardner a question?
Mandy here from Rogers.
Go ahead then, please, Mandy.
I have a couple questions, Dr. Gardner. The first one is with regards to, when you said you're seriously considering putting Muskoka back into lockdown. What's your time frame that you're thinking of that? Watching the numbers the next 1 or 2 days or the next 5 days? What are your thoughts?
Well, first off, I don't have the ability to put us into shutdown or lockdown. That is a provincial decision, but I do have the ability to advise that they do so. That's an important decision for me to make. And well, I've got my data right now. We get data day to day, but generally it's a week-long process to get more data, see the trend. I'd be watching the trend over this week for sure.
And then potentially making a suggestion by the end of the week.
Yeah, and often we're asked on a weekly basis, often, depending on what's happening locally. Certainly the province makes their decision on a weekly basis.
but you're thinking the way the data is headed right now, that you may be suggesting that back to the province.
I am considering this, yes.
Great. Last question. In regards to the antibody testing that was being offered at Life Labs, I believe for $75, have you any research or data following up on that? How many people are utilizing it, if it is being utilized?
So far, the province's position is that antibody testing is useful as a laboratory research tool to determine the prevalence of transmission in the community. And so on a periodic basis, researchers have done a random sample of some kind of tests from individuals in the community to see how many have been infected to date. An antibody test will show if you've been infected in the past at some point. It doesn't tell you when. It doesn't tell you if it's happening right now. It just tells you that it happened at some point in the past. So it can be helpful for us in public health to know the prevalence of infection in the past, because that tells us whether or not we're anywhere near herd immunity, whether the population remains unprotected. And from what I've read, most places in the world, certainly in Canada, still have a really low overall cumulative incidence of COVID-19 with antibody testing. That the great majority of people have not been infected to date and therefore are vulnerable to infection. It can also be useful clinically to help sort out complex medical situations for severe cases, including in children, but would not be useful generally for most individuals.
Wonderful. And just a quick follow-up to that, what was there was a jury that they said it could detect up to. Do you remember what was that number?
Could you say that again? I couldn't quite hear you.
Sorry, there was a time frame, a duration of months that it could detect up to, or for previous infections to. What was the period of time?
Yeah, offhand, I don't know. My understanding is you do retain antibodies for, this is a relatively new disease, right? But even so, that if you're positive you were infected at some point in the past year when the virus first arose in our population. But I'd have to actually have a look at the reference that you're referring to.
Okay, thank you very much.
You're welcome.
All right, then, one last call for questions before we send Dr. Gardner for today.
I have Nancy.
I'm sorry, go ahead. Who is this?
This is Erica. I just have a clarification question on the outbreak list on the website. Barry Manor is included. It's my understanding that it's not actually an outbreak at the retirement home, but at a rehab facility, and they're in the same building and kind of share a hallway. So I just wanted to confirm that all of you refer to like resident cases and staff cases, if they would maybe just be patient and staff cases, and if they're all still confined to that rehab facility.
I will look into that and get back to you.
Okay. Thank you.
You're welcome.
And let's go on. Here, can I just ask a question?
Yes.
Please go ahead, Dawn.
Thank you.
Dr. Gardner, I wonder, I think earlier in the call you said that there was evidence of some people who work in Muskoka but live in Barrie that has resulted in some transmission. Did I hear that correctly?
That is true.
Okay, and then can you comment on whether that's related to the variant or not?
I can. It is.
It is related to the variant?
A variant of concern. We don't know exactly. They're awaiting confirmation as to which type.
Okay. And so, I know there's a balance between people needing to work and us needing to clamp down on transmission, but would you be advising companies to try to find other locations for their employees to work so that they're not limited to
That's an important point. It would help reduce transmission between regions.
Okay, thank you.
You're welcome.
Okay, Dr. Gardner, I think that's the end of our questions for today. Thank you very much, and thank you everyone for joining us today.
You're welcome. Have a good day.